Welcome to today's quick healthcare news updates. Google is advancing digital platforms, forming partnerships with healthcare agencies, and promoting disease prevention, with generative AI models playing a crucial role, according to Karen DeSalvo, the Chief Health Officer of Google Health. DeSalvo indicated that despite the promise of innovative technologies, generative AI alone will not cure health and disease. It is one of many tools, along with equitable healthcare access and preventive measures like vaccines. Technology is driving medical advancements rapidly. Technology democratizes access to healthcare globally, allowing quicker and more equitable progress. AI's impact on health could be as revolutionary as penicillin, transforming healthcare on a global scale. However, today's health challenges are complex, involving factors like inactivity, poor diet, genetics, and social determinants. Addressing these requires integrating data from multiple sources to develop personalized care pathways where generative AI can play a vital role. Google is deeply involved in healthcare through two main avenues. It provides cloud services and platforms to governments, healthcare systems, and scientists, helping them advance health. Additionally, Google offers direct-to-consumer products like fitness trackers, Google Search, and YouTube. The COVID-19 pandemic highlighted the importance of accurate public health information, emphasizing Google's role in disseminating critical information in collaboration with partners like the World Health Organization, WHO. The pandemic also underscored the responsibilities of providing information via internet searches. People rely on Google daily for answers, making information dissemination a significant part of Google's mission. However, managing the quality of vast amounts of content, especially with the rise of generative AI, is challenging. Efforts to address misinformation are vital, but individuals also need to develop the ability to identify trustworthy content. Google focuses on empowering healthcare providers and fostering partnerships, platforms, and prevention. For instance, it helps direct individuals with type 2 diabetes to trustworthy YouTube videos that complement their physician's advice. Google's partnership with the UK National Health Service is developing an AI-driven image reader for mammography, speeding up results for patients. Google's AI tools are often open source, allowing free adaptation by developers. This approach is exemplified in their collaboration with the Indian government to create an application programming interface for chest X-ray readers, reaching more frontline clinicians. Other AI-driven tools include an Android app for health volunteers in Kenya, supporting expectant mothers. One notable AI initiative is AlphaFold, which predicts protein structures to aid drug discovery and has applications beyond healthcare, such as sustainable food sources. Google hopes others will use their open-source tools to create ecosystems and achieve more collectively. Google is leveraging technology to transform healthcare through innovative partnerships, platforms, and preventive measures. While AI holds significant potential, it is part of a broader strategy to improve global health. Next, impact of blue screen of death computer outage on health. The recent Crowdstrike internet meltdown that disrupted some health systems' procedures and billing highlights the vulnerabilities facing medical facilities in the digital age. Experts warn that this incident may foreshadow future threats and disruptions. The U.S. health system is still grappling with the repercussions of major cyber attacks, such as the massive Change Healthcare ransomware incident. These events underscore the sector's dependence on a few key technology companies for their IT needs. In an interconnected world, a large-scale outage can halt elective procedures, disrupt pharmacy orders, telehealth, and 911 communications, and render medical devices and electronic health records unusable. The immediate concern is the potential for bad actors to exploit the chaos. The Federal Cybersecurity and Infrastructure Security Agency has already observed threat actors engaging in phishing and other malicious activities. The American Hospital Association reported varying impacts from the outage, with the hardest-hit health systems activating backup plans and adjusting workflows while manually restoring IT systems. Some institutions, like Boston's Mass General Brigham, canceled non-urgent visits and procedures, while Memorial Sloan Kettering Cancer Center halted procedures requiring anesthesia. Other hospitals delayed services or rerouted patients. Epic, a major electronic health records company, stated that the outage affected some laptop and desktop workstations used used to access its systems. Issues with data center software also prevented some facilities from using multiple systems, including Epic. Looking ahead, health systems may need to reconsider their reliance on single large vendors and explore in-house solutions. Crowdstrike, which secures data and detects cybersecurity risks on over 1 million devices in healthcare organizations across the country, was at the center of this disruption. The outage, resulting from a faulty software update, affected devices using Microsoft Windows, causing the blue screen of death and locking users out of their systems. Healthcare's push towards technological advancement and interoperability has increased the potential for such crashes, given the widespread reliance on common platforms. Even hospitals that diversify by hiring multiple vendors may be vulnerable if those vendors use the same software, creating a single point of failure. The federal government has the infrastructure to create resiliency, cybersecurity, and data privacy standards that could mitigate the impact of cyber attacks or outages. However, as the world becomes more interconnected, organizations might consider managing certain aspects in-house to reduce dependency on external vendors. The response of regulators and policymakers to this incident, whether through new guidance or standards, remains to be seen. The Crowdstrike outage serves as a stark reminder of the critical need for robust cybersecurity measures and diversified IT strategies in the healthcare sector. Next, billions in payments to doctors. A decade of publicly disclosed data reveals that doctors receive billions of dollars annually from pharmaceutical and medical device companies. Despite efforts to increase transparency, this practice persists, with payments influencing doctors' prescription decisions and increasing the use of specific drugs and devices. The Open Payments Database, launched in 2014 as part of the Affordable Care Act, aimed to reveal financial relationships between the medical industry and healthcare providers. However, the amount of money paid to doctors has grown. In 2023, companies paid $12.75 billion to medical providers, up from $6.49 billion in 2014. This increase partly reflects inflation and expanded disclosure requirements since 2020. Regulators have warned that repeated payments to doctors for speaking engagements or non-educational events could violate anti-kickback laws. In 2023, a drug company paid over $54 million to 1,138 providers, averaging about $47,000 per provider. These payments raise ethical and legal concerns, yet the data does not identify specific companies or doctors involved. While patients can access the Open Payments database to see if their doctors receive significant payments, this transparency hasn't significantly changed industry or physician behavior. Recent payment data shows a range of expenditures, from questionable to potentially illegal. Despite this, patient trust in healthcare remains affected, with little evidence showing patients using this data to choose physicians. A study published in the Journal of the American Medical Association found that while the number of physicians receiving payments declined slightly between 2014 and 2018, the total value of benefits provided remained stable. A small percentage of doctors received the majority of payments, indicating companies may target those most susceptible to influence. Historically, compliance with anti-kickback laws has been the responsibility of companies and individual doctors. Recently, some hospitals have become more proactive in managing external relationships and compensation of their physicians. Many hospitals now require annual disclosure of external relations from their doctors, using Open Payments data to vet these disclosures and screen for conflicts of interest. Hospitals must navigate potential conflicts of interest, particularly when doctors have financial ties to medical devices or treatments they might recommend. Failure to manage these conflicts can lead to significant consequences, including legal liability. Despite these efforts, the use of Open Payments data by hospitals to address these issues remains inconsistent, particularly for smaller, less resourced institutions. While the Open Payments database aimed to increase transparency and reduce undue influence on medical decisions, payments to doctors from pharmaceutical and medical device companies have continued to grow. The data has helped refine marketing strategies rather than curb the practice, and hospitals are now more actively managing potential conflicts of interest among their staff. However, consistent and effective use of this data across the healthcare industry remains a challenge. And now the interesting healthcare facts segment. A data analysis from the American Hospital Association shows that 84% of most hospitals are community hospitals. 58% of U.S. hospitals are non-profit and non-government affiliated. The analysis also showed that 68% or two-thirds of community hospitals are affiliated to a larger hospital system, and 32% are independent. It also shows that two-thirds of community hospitals are located in urban areas, while the remaining one-third are located in rural areas. And there you have it. Please subscribe to the channel and we'll see you next week.